Hello everyone, my name is Sangam Chimnajimanne. To today the discuss our topic is medical coding. Medical coding is the process of translating healthcare services, diagnosis, procedure and equipment into standardized codes used for billing, research and healthcare. It is critical component of the healthcare revenue cycle and ensure that healthcare providers are mm, removed accurately and by the insurance companies and government. To the below is a detailed introduction to the medical coding. What is medical coding? Medical coding is the involves revenue patient medical records and standardized codes to the services provided. These codes are derived from universally recognized classification system. To the purpose simplifies communication between healthcare providers and payers and regulatory agencies, ensures accuracy in billing and remembering that the facility statistical data collection for research and mm, public health management. To the click classification system is the medical coders use several coding system depending on the context of the medical services. That the one point ICD, International Classification of Diseases. To the mention by the World Health Organization WHO used to code diseases, condition and causes of the death. Current version ICD. To the clinical modification the US second number CPT, current procedural terminology. To the mention by the American Medical Association that the described the medical, surgical and diagnostic procedure. That 3 point HCPCS healthcare common procedure coding system that include CPT codes and additional codes for services like ambulance rides or medical equipment. That the level 1 CPT codes, level 2 no physician services supplies and equipment. Mm, that 4 number DRG diagnostic related group used for hospital billing to classify inpatient hospital cases into group for remembering that the codes are derived from the key components of medical coding. Mm, one point medical records review that the coders review charts, physician notes and reports to extract relevant information. Second, assigning codes. Coders assigning the appropriate codes based on the documentation. Third, ensuring compliance. Accurate is the coding is the required to complete with regulation like HIPAA, that the Health Insurance Probability and Accountability Act. 4 number submitting claims. The codes are sent to insurance companies or government payers for remembering that the skill and that the skill and qualification for the medical coding. That's one point knowledge of anatomy, physiology and medical terminology, essential for understanding patient records and assigning accurate to the codes. Second number attention to detail. Errors in coding can lead to claim Daniel's organal issue. That the 3 point certification CPC certified to the offered by the American Academy of Professional Coders. That the CCS certified coding specialist offered by the American Health Information Management to the association. AHIMA CCA certified coding associated entry level. That the AHIMA uh, mm, 4 point familiarity with coding software. That the used of tools like encoder pro 3 encoder. Challenges in medical coding. That's the one point complexity of codes. thousands of codes across a system like ICD-10, CPT, and HCPCS. To the second point, keeping up with changes, frequent update to coding guidelines and regulation. Third point, ensuring documentation accuracy. That the ensuring documentation, the coders rely on and confidential document that the from healthcare providers. That's the 4 point, regulatory compliance, ensuring adherence to the standards to avoid legal and financial penalties. Career opportunity in a medical coding offers diverse career paths, including inpatient coding. It is the specializing in coding for hospital admission, outpatient coding, focus on the coding for ambulatory services and clinics, uh, auditing revenue, and improving coding accuracy to the consulting and education training. New coders are advising healthcare to the organization for the future of medical coding, automation to the and tools like natural language processing are increasingly used to automate coding processes. Increased demand as healthcare system grow and become more complex. Skilled coders are in high demand. And that's the conclusion. Medical coding, it is the focus on the integral role in the healthcare industry by the um, bridging clinical and that's are the financial management. It requires technical expertise, attention to the detail, and the committee the accuracy to ensure healthcare system operate efficacy. That's about the medical coding. Thank you.